Karibu sana. Hapa ni Ruaraka Baptist Church, and hapo watu wasema everyone is precious and Christ is all in all. Now, I don't know if you would like to introduce yourself, what you do, where you work, kabla tuendelee.
Yes, of course. My name is Treva Otieno MLT. I work at HBI Outpatient Center, as is located in Ngumba Estate in Nairobi. Yes. Basically, I'm a lab technologist. I deal in disease diagnosis. Yes.
Wow. Lab technologist.
Yes.
Heavy things hapa hivi. So currently, kwa country, we are going through a pandemic. Yes. Actually, inafaa niulize hii kwanza. What's the difference between a pandemic na epidemic?
Okay. An epidemic normally is localized. A pandemic is something that has a global impact and spreads very fast.
Okay.
And normally the cases that arise begin spontaneously. For example, we might report a case in Nairobi today. Tomorrow there's another case in Kisumu.
Okay.
Okay. The next time we'll be hearing another case in Malawi, South Africa. Now that is a pandemic. It has a global impact.
Oh, okay.
Yes.
Wow. Heavy stuff. Now, today we are facing coronavirus, COVID-19.
Yes.
So, what is corona? What is coronavirus?
Okay. Coronavirus is just as we have already said, a virus. It's a virus. Majorly classified in a wide scientific classification that I don't think I should be going through. But okay, we normally classify them as members of the family Coronaviridae, and it's a respiratory. The coronavirus itself is a respiratory tract virus, which means it affects the respiratory tract of humans, and it has been known to be carried by animals, especially bats. But human infection is common, because we can remember there was a case of the Middle East respiratory syndrome, was also caused by coronavirus. We had the SARS, severe acute respiratory syndrome, was also caused by coronavirus. Okay. So COVID-19 by definition, or it was named COVID-19 because of the time when it appeared. That is, the first case was reported in 2019 towards the last quarter in China. Yeah.
Okay. So you're saying that corona is not the only one of its kind. Now, this is not the first time it is affecting the world.
We are facing coronavirus infection.
Okay.
Yes.
So we should not be too worried. But wasema COVID-19 stands for coronavirus 2019 or something like that?
Yes, it refers to coronavirus 2019. 2019 is just a coding that has been put to identify that the latest infection of corona that emerged in late 2019.
Okay.
Yes.
Oh, nice. So umesema that zinapatikana in animals. This virus is mainly in animals, sana bats.
Normally they're very common in animals.
Okay.
And COVID-19 especially, it's suspected to have been transmitted from a bat.
Okay.
Yes.
So what you're telling me ni hii story nimekuwa nikisikia that somebody took a bat, a snake and wolf, akaunda supu akakunywa akapata corona.
Well, that might not be verifiable because it's a lot of speculation. Okay, people come up with stories to suit their own motives.
Okay.
But what is commonly known is that coronavirus is found a lot in bats.
Bats. Okay.
Yes, that is scientific.
That's scientific.
There is no myth about that.
So
so people started coming up with theories that some people were feeding on bats, and then the virus got transmitted to the humans and got propagated from there on. There are other theories as well that the Chinese build a virus in a lab. They are not things that can be verified.
Oh, okay.
Yes.
So there are many myths.
There are many myths.
Are there any other aside from hizo?
Okay, concerning the source, now there are myths surrounding coronavirus, all the way from how it started, how it's transmitted through humans, and how people think they can cure it. But to begin with, we have people who unfortunately believe that coronavirus is not there, that someone somewhere is in a fear-mongering spree, and that is not something that is true. We have seen cases We have witnessed people getting infected in other countries, people are dying, and we cannot say that the virus is not there. Okay. Secondly, we have people saying that talking about means in which coronavirus may or may not be transmitted. People don't believe that by shaking hands they can get infected. So some individuals are going about their normal activities, greeting each other, hugging, and all sorts of unnecessary contact because they believe that they might not get infected because of the coronavirus. Other myths around treatment, people have come up with different formulations of how they can treat coronavirus. Some people claim that chicken soup can treat coronavirus. Lemon, though there is a bit of science behind lemon, which I'll talk about later. Then we have the issue of what do you call it?
Madawa tu.
Okay, people are talking about concoctions, herbal medications, which are, so far there's no scientific evidence to back them up.
Okay.
Yes, and then we have people talking about black tea, especially the issue of black tea is so widespread that people actually believe it. But then all these have not been verified scientifically.
Okay.
Yes. Now talking about, I wanted to say something about lemon. Normally we get vitamin C, what we call ascorbic acid, from lemon, and it is believed to boost the immunity of humans.
Okay.
So it's okay to take lemon as a measure to boost your immunity. Take ascorbic acid. We have medications that are specifically meant to boost ascorbic acid, but it's not a measure towards treating or curing coronavirus.
Okay.
Yes.
Now, corona is a virus.
Yes.
Yeah. I have very little scientific knowledge, but I'm aware that viruses are not actually living things.
Yeah.
So how is that? I've never understood that. And maybe because they're not living things, then hakuna cure then. You can't kill something that's not alive. So
okay,
how do you get cured?
Okay, viruses, there's a broad definition of viruses, but basically a virus is composed of something called a nucleic acid. A nucleic acid is in simple terms, I can call it the brain of a cell. It is what engineers the structure of the cell that leads to what forms the internal and the external parts of a cell. Now, a virus is composed of a nucleic acid and, of course, protein coating and other components surrounding the outside membrane, which in its own self can be able to propagate a series of other events that can lead to multiplication of an individual virus. The reason why a virus is usually not defined as a living thing is because it lacks the other components of a cell. Okay, we don't have sources of energy like ribosomes.
Mitochondrion.
Yes, we don't have things like the mitochondrion. There's a lot that means in a virus that would warrant it to be defined as a living thing. Then there are many ways in which a virus does not exhibit the characteristics of a living thing. For example, it is not able to move. They don't move. They are normally carried, on surfaces. Okay, even when a virus is within your body, in its own making, it cannot decide that it wants to move to your brain or to your leg. Okay, the virus has to be carried in a cell, and then the way it multiplies is that it will use the machinery of the cell. It will use the nucleic acid within the cells to divide itself. It cannot decide to divide itself on its own. Okay, a virus has to be within a cell, a living cell for that matter, to be able to multiply and increase in number. Yes.
Wow, deep stuff. So, could you tell us some do's and don'ts regarding corona prevention and keep?
Okay. The World Health Organization and other ministries of health within our countries have already given guidelines, and okay, so there are guidelines that have been put forth that will help in preventing the spread of the virus, and there are things that we've been told to do and not to do. Okay, but first I would like to start with how to prevent the spread of the disease. Okay, we have talked about washing your hands, and washing your hands means you wash hands with enough water, a lot of water, and soap. Soap is included in the formula. Okay, you don't just wash with the water. Include soap, or you can clean your hands using an alcohol-based sanitizer. Okay, that has a great impact in destroying the virus in case you have touched a contaminated surface. Then we have other preventive measures. We have social distancing, which by definition is maintaining a distance of at least a meter between you and the other person. Okay. Now, distancing, that is physical distancing. Maintain a distance of 1 meter between you and the other person. A meter is about 2 to 3 steps. So you can approximate 2 to 3 steps from the other person. That should be able to protect you from getting contaminated. Okay. And then other preventive measures, we talk about respiratory, your hygiene, respiratory hygiene, and the practices you put forth. For example, during when you are coughing or sneezing, you are advised to sneeze in your elbow or into a handkerchief, which you should wash frequently, and then generally staying clean. That should be able to keep you from contamination.
Wow. Yeah. I can see you're here with some gear. I can see a face mask and
yes,
goggles.
Yes, as a medical personnel, I have to protect myself from getting infected because I see a lot of patients regularly. You never know who is infected and who is not infected unless you done a comprehensive review of a patient. So what I have is an overall, a dust coat, though it doesn't cover me entirely. It's advised that it should be able to cover the whole of your body up to your feet, at least. And then I should have a mask. As you can see, this one is my mask. This one should be able to protect me from droplet spread. Normally, one of the commonest ways by which the virus is spread is via droplets. Okay. One myth I forgot to mention is that people believe that it is airborne. Okay. Something that is airborne is totally different from a droplet spread. For example, when I'm speaking to you very closely, when I sneeze or I cough, a drop of saliva could come from my mouth and land into or onto your body surface. If it gets into contact with the mucosal surface, such as your mouth, your nose, or your eyes, it could cause contamination. Okay? So that is why I have all this. I have to protect my mouth and nose so that in case there is a droplet in the air, it doesn't come into contact with my mucosal surfaces. The goggles, I removed them. These ones are supposed to protect my eyes and the region surrounding it so that there is no droplet that gets into my eyes. Okay. Then, of course, the covering of the head in case there is a contact. These are body surfaces that we could easily touch and could easily get ourselves contaminated.
Okay.
Yes.
Oh, but now you are a medical professional.
Yes.
Me as a non-medic, can I go to a shop and just buy these things and wear them?
Well, that would be very unnecessary. I can see a lot of people are trying to discourage the use of masks. Masks are welcome. You can use them. Normally, people wear masks if they suspect that they are infected, and that is what is advised. Not everyone needs a mask, okay? But if you suspect that you could be having a respiratory tract infection, you can put on a mask so that you protect the others, okay? But the other gear, you don't have to walk in a dust coat or goggles so that you protect yourself. It won't be necessary because you'll be walking in the public, and as long as we maintain the regulations of keeping a 1 meter distance, there is no need for all this protective gear.
Okay.
For someone like me, the reason why I would need them is because every single patient could be a suspected case, right? Yes.
Ni wengi.
Yes.
So, okay. So what you're saying is keep the social distance here, 1 meter. If you suspect you're infected, you can wear a mask, but wear it on your way to hospital.
Yes.
See you back in Bani.
Yes, that is very important. It's important that you get to know that when you suspect that you are infected. Okay. There are symptoms that have already been identified commonly. So I'll just mention a few. We talk about a dry cough, and this is not just any kind of cough. It's a cough that normally originates from, you can feel it from behind the sternum. Okay, it feels like it's coming from within the lungs. It's not like when you make your voice like we don't classify that as a cough. So a dry cough, we talk about sneezing. Then we talk about fever, high temperature. We talk about other symptoms that may vary from patient to patient. Like we talk about anosmia, which is it's not a very common symptom, but then you might not be able to, you might lose a bit of your sense of smell.
Oh, that is anosmia.
That is anosmia. And then we talk about an altered taste within your tongue. You might not be able to completely feel the taste of stuff that you eat.
Okay.
Okay. And then we have things like headache.
Okay.
Yeah. So whenever you feel any of those symptoms, there's no need to panic. Just try to evaluate yourself. And when you feel that they're advancing, seek medical attention.
Okay.
Yes.
Yeah. So the best way, when you suspect you're ill, you feel you are a dry cough, high fever, go to hospital.
Go to the hospital.
Don't wait to be carried.
Yes, and it's important that when you are going to the hospital, it's important that you inform the medical personnel that you find there what it is that if you feel that you're having symptoms of the virus, it's important that you make it clear to them. Okay.
Okay.
The latest case of a clinical officer who got infected, actually the patient denied having traveled. Okay, and that was very unfortunate. So we should be having a case where you are very open. Don't be scared, but be frank. Okay. Getting infected with coronavirus doesn't mean the end of
yako.
Yes. Okay.
Yeah.
We have had people recover.
Okay.
Today we had the good news of the first patient. She has recovered. That is good news, and that should be hope for the rest of us.
Yeah, for the rest.
So when you go to a hospital, be frank about the symptoms. Be frank about your travel history to help the medical personnel identify what could be disturbing you.
Okay.
Yes.
Wow. So people are asking, what is quarantine? Why is it very important that some places equal lockdown? Why is it that people are not working now? Yeah.
Okay, there's a lot of issues around quarantine and lockdown and such kind of things. But to begin with, quarantine normally is warranted by the fact that the infection itself takes about 10 to 14 days to start showing signs and symptoms. That is what we call the incubation period. So within this incubation period, there might not be symptoms. You might not experience any symptoms when you are infected. But by 14 days, the virus is already within your body. It has developed and it's already affecting you, and you may be able to show signs and symptoms. Okay. So the reason why people are advised to quarantine is because we need a period of 14 days for someone who has been at risk or has been exposed. We need 14 days to establish whether you are infected or not. Okay. So the reason why you are told to quarantine simply means you put yourself in some kind of isolation. You can see it could be within your house. Of course, mostly it's within your house. Or for people who have traveled into the country, I can see the government has organized for some hotels, and now we are working on schools to get places where we can quarantine infected people who are suspected to have been exposed to the virus. Okay. So within this period, you're supposed to stay indoors. You monitor your symptoms. And within a range of 14 days, it should be clear whether you're infected or not.
Okay.
Yes. Now, coming to the issue of lockdown and curfew and the rest, I think the government has done a bit of consultation to maybe find ways in which they can reduce the spread of the virus. Okay. Normally, from the reports we get is that the hours of the curfew, normally there is a lot that goes on, especially in the evening hours. People go to clubs, people interact a lot, and there's a very high risk of spreading the virus. Okay? So the reason why the government has put a curfew is to limit the spread of virus by limiting interaction of people. Okay. Now, a lockdown is not something I would wish to talk much about right now. I'm not sure if how easy it is to implement, but it basically means that there will be no movement, whether during the day or the night. People are expected to stay indoors and avoid moving from place to place. Yeah, but then that would be, I think I would call it a last measure.
Okay.